Hi, I'm Dr. Noah Kaufman, founder of KaufCare, and this is the reason why I made KaufCare. There's a huge gap and a huge problem out there today. Urgent cares are usually owned by private equity or large hospital systems and generally are staffed by APPs or mid-level providers with varying degrees of skill. Some of them are really good. I've worked with them and I would trust my life with them. But many of them have maybe only trained for a couple years. The urgent care is set up to see very easy type of problems, like a strep throat, to swab a test for COVID. And oftentimes, more complicated medical care is better suited for the emergency department. Frequently, the model of urgent care is to see as many people as you can at a relatively low cost. And it's great for keeping people out of the ER for very simple problems. If you sprain a finger, if you've got a teeny little splinter, that's the urgent care. The emergency department, on the other hand, is like a catch-all. It takes everything. And people want to see a board-certified emergency room physician, often with 10 years of experience. And I get it. There's a lot more training, a lot more experience. And people just understand that if their problem is a little bit more complicated, they want someone with the best training possible. Everybody wants the best doctor possible. I want the best doctor possible. But the emergency department, you might be waiting for 6, 8, even 10 hours. And then nobody knows the prices. When you go in there, you're going to get bills for months. And we all hear these horror stories about $15,000, $20,000 bills for a shoulder dislocation or something like that, something that can be absolutely financially devastating. I've been an ER doc for 23 years, and it is horrible when I have patients come in and say, last time I was in here, I got an $11,000 bill. Here's the thing. So many people never reach their deductible. Their deductible might be $5,000, $6,000, $7,000 or more. I've heard even over $10,000. That can be financially ruining for patients. Yes, you're going to get great care. It's a safety net for society. You should absolutely use it for a heart attack, stroke. But that's this huge gap. And what's in the middle? Well, your family doc isn't going to reduce your shoulder dislocation or do an ultrasound to rule out a blood clot in your leg. So what do? I saw this as a major problem and I created KaufCare because KaufCare is right there in the middle and meets that gap. We take care of like 95% of the ER stuff that is not life or limb or sight threatening, but we can do ingrown toenails. We can do, large abscesses, like a big boil. We can cut those open and pack them for you. We can do large lacerations, even through into muscle. We can do dog bites to the face. We can do antibiotics. We do IVs. We have x-ray machines. We have ultrasound. We have basic labs, and we can send you out for the CLIA labs like D-dimer and things like that. You're going to get the top level care for any procedure you might need. And also you're going to get very transparent and honest care in terms of the pricing. And that's why we publish all of our prices online. You can go right now to kaufcare.com/pricing, and you can see what a chest x-ray costs. You can see what an EKG costs. We have multiple discounts. And that is also a very, very different approach to medicine than the urgent care or the emergency department. Part of the reason we don't take insurance is because we can cut out the middlemen. We can remove that bureaucratic layer of administration where we need coding and billing and someone to fight for our patients when there's denials of claims. And, insurance companies, their default is to deny everything and then okay, we'll walk it back and turn it around. And the reason is what are insurance companies, and in fact, what is the whole hospital system, what is it incentivized to do? It's incentivized to keep you sick. It's incentivized to make money. And the hospital and the insurance companies, and not all hospitals are like this. There's some really good ones, and there's a lot of really good doctors who really care. But insurance companies, large healthcare systems that are consolidating, they are so out of touch. And we are all so frustrated. And it's time to make a change here. So I'm doing my little part by creating what's called a direct acute care. Now, you may have heard direct primary care, DPC, and that's just bringing it back to the old days, right? Doctors are burning out like crazy because Whether we know it or not, we're part of a system that does great financial harm to our patients. It's just not right that a patient comes into the emergency department with a cut on their arm and has no clue what it's going to cost. But if you're insurance, it might cost like $15,000, and then you're on the hook for your $5,000 or $8,000 deductible. And so something's got to give. This whole system has to change. And I've started by creating a direct acute care, first of its kind in Denver. And we publish all of our prices transparently. We work with patients. We've cut out all the middlemen, all the insurance, the big hospital system, save the hospitals for heart attack and stroke and cancer and the bad things that you really need specialists for. Now, there's also direct specialty care, direct surgical care in Denver with Smith, and then direct primary care with Balanced Health, with Pinnacle, some of our partners who offer these great services and are also doing the right thing in medicine. And this is absolutely the future of medicine. You know, you're going to save a ton of money and you're going to get some of the best care possible out there through direct care, whether it's direct primary care, direct acute care like KaufCare is at our first location here in Jefferson Park, or direct surgical care like Smith or Surgical Center of Oklahoma, who kind of pioneered the way for us. And so there's a big gap between urgent care and the emergency department. And that's why we made KaufCare. The urgent care on one hand is high volume. The emergency department is also profit motivated because the hospital is trying to make as much money as it can. And so are insurers, and so are all these stakeholders who are extracting value from the system. But you're going to wait for 6, 8 hours, 10 hours, and you're not going to know your prices, and you're going to get ridiculous bills that we've all seen, like $10,000 for a fracture, something that you could have gone somewhere else for. So both of these systems are optimizing profit, not patient outcome. And that's why we call this sick care. And in America, we don't have healthcare really. We have sick care. We have a system that is incentivized to keep patients sick and to charge them as much money as they can so that stakeholders and shareholders can make as much as possible. We think that's absolutely wrong. We are bringing medicine back to the way it should be. This has to change. And that's why we created KaufCare. Our primary outcome is health outcomes. I can't tell you how many people I've seen at KaufCare already, and we've removed price. We are taking care of people at a fraction of the cost of the emergency department with the same level of quality care as anyone would get from a 20+ year board certified emergency room physician. It's time to make a new movement, whether you're going to direct primary care, a direct acute care like KaufCare, or direct surgical care. It's time to get rid of the insurance, time to get rid of the costly hospital visits to the ER. We can do this. It's time to be done with sick care in America.